I'm Sujata, the editor with Healthcare Radius. Glad to be meeting you today.
Same here.
Could you explain on the incidence and the types of deafness in India?
Deafness, or what we call hearing loss, in both adults and in pediatric population is often underestimated in India. Like if you look at the trends of visual disturbance versus hearing disturbance, you know that whenever any one of us, whether it's adults or children, have any kind of visual disturbance, we go to an optician, we put a spectacle, and there's no stigma associated anymore when it comes to visual loss. But when it comes to hearing loss, the same parent or the same patient or the person would hesitate to go to a ENT surgeon or an audiologist to pick up, and if diagnosed with some amount of hearing loss, he or she would probably hesitate to put a hearing aid or use any sort of rehabilitation. So the usage of hearing aids or implants vis-a-vis usage of rehabilitative devices for visual disturbances, there's a huge difference. And this is the reason why a lot of diagnosed deafness or hearing loss persists in the community, and it's most often left untreated, which is quite sad. Coming to the exact incidence in India, close to 4 out of 1,000 live births in India end up with some kind of profound hearing loss or hearing loss that needs to be rehabilitated. This is supposed to be approximately 6.3% of the total population, which means that 63 million people in India today have some form of moderate to severe hearing deformity. So that's a huge number of patients who are out there requiring treatment, and a very, very small percentage of these people are rehabilitated either with hearing aids or with implants like cochlear implants, bone anchored hearing implants like Ossia and other technologies that are available. In fact, the number of cochlear implants in India is close to about 200,000, which is much smaller figure when compared to the 63 million people out there who have some kind of hearing deficiency.
So could you give us an insight on cochlear implants? What are the pros, what are the cons, and how do they work?
Cochlear implantation is a technology that restitutes hearing in what we call sensory neural hearing loss. Now, hearing loss can be of two types, for which one needs to understand the anatomy of the ear. I have here with me the picture of the ear. So you can see here that the ear has three parts: the outer ear, the middle ear, and the inner ear. So the outer ear is separated from the middle ear by what's called the tympanic membrane. The middle ear then has a bridge of three small bones which connects the tympanic membrane to the inner ear. Let me use a pencil here to mark it out. So the inner ear is where we have the cochlea, which is often, which can be considered as the engine of hearing, or this is where the sensory neural junction. So the nerve endings start from the cochlea and go into the brain through a canal called the internal auditory canal. So now the problem in hearing can be either in the outer ear, mid ear, or in the inner ear. So any problem in the outer ear or the middle ear can be corrected by surgery or by simple hearing aids, which means that there is no problem with the neural circuit. But when the problem is in the cochlea, or the junction between the cochlea as a structure and the nerve, what we call the sensory neural junction, that is when one needs to adopt or resort to more, I would say, high-end technology and surgical options, which insert what we call a cochlear implant, which then restitutes or brings back hearing. So sensory neural hearing loss is inner ear onwards. The conductive hearing loss is outer ear and the middle ear. So these are the two types of hearing loss. So if there is if there's a nerve that's all right, as I told you, one could resort to surgery of the outer ear or the middle ear. And if additional hearing rehabilitation is to be done, one could going for what we call a hearing aid. The hearing aid is just an amplifier of sound. It's like a small miniature loudspeaker. Of course, there's a lot of technology associated with it, but it does nothing to change the status quo in the inner ear. So for a hearing aid to work, one needs to make sure that the nerve or the cochlea onwards, everything is all right. Now, if there's a problem, as I told you, in the inner ear where the neural circuits are involved, then we need to do something around this area. So this is where the cochlear implant comes into its place. So a cochlear implant has two parts: an implantable device which goes under the skin and which is fixed to the bone, with an electrode that comes, which is pushed from a hole that's done behind the ear in the bone, and that's pushed into the middle ear from behind the ear again into the inner ear called the cochlea. So there's a small hole in the cochlea called the round window, which is where we insert the electrodes, which then go along the turns of the cochlea. The cochlea is a snail-like structure. So this electrode remains within the cochlea, and the device which is fixed to the bone also remains under the skin for the rest of the life of the patient. So this is surgically implanted. Then we have what is called the processor. The processor and the microphone and other devices, equipment which are bundled into another structure, which then forms what is called the external component. This internal component and the external component attach themselves to each other through a magnet. So there's a magnet inside in the part which is attached to the bone, and there's a magnet in the outer component as well. So once the outer component is brought close to the inner component, which is under the skin, they latch on using the magnet, and that stays on the skin. So this is what is a cochlear implant as a device. It's got an outer component, inner component to be surgically implanted. Outer component can then be fixed, and this completes the circuit. So we do what is called a switch on after the surgery after 3 weeks. So that is when the patient or the baby actually starts hearing all over again. So that is cochlear implantation in very broad terms. There's a lot of technological and technical details which obviously which won't be possible to be explained in the purview of this discussion. But yes.
I just have one question. Why the 3 weeks interval between the implant and switching on?
Yes, what we do is we do an incision behind the ear, retract the skin, expose the bone behind the ear, and we do the surgery that's necessary to put the electrode in, and then keep the implantable device there fixed to the bone. Now, after surgery, it takes about 2 to 3 weeks for the skin to come back to normal. There are sutures that have to be removed. The skin is obviously edematous and inflamed, so it'll be thicker. And when the skin is thick, the magnetic attraction obviously won't be optimal. So the external device may not stick on magnetically to the internal device, which is the reason why we give it 3 weeks for the whole inflammation, the surgical site to settle down, where the skin thickness is back to normal, and that is why we put in we fix in the other component, which is then switched on. And of course, there's a lot of things that we do during switch on. So the implant itself has an internal receiver stimulator complex and outer processor. So they need to talk to each other digitally. So this information is so basically the sound is taken through a microphone, processed, and the processed sound is sent inside through a digital exchange mechanism. And the inner component then takes the processed sound into the cochlea and feeds it to the electrodes. So this is a part of the switch on effort, where we tune in the whole device along its various frequencies, and then the patient is able to hear optimally.
The Ossia system that you mentioned, it is hailed as a game changer when it comes to hearing loss. Is it going to be the cure for hearing loss?
Now, coming on to Ossia, one must understand that it's a different portfolio of implant, and it is separate from cochlear implant. Now, an Ossia implant, which is a new implant that's come from the stables of the company called Cochlear, based out of Melbourne, Australia, is a new age implant where this implant is used for bone conduction loss, which means that if the nerve is all right, and if there's a problem in the outer ear, middle ear, due to which the patient has irreparable hearing loss. Let's say the patient has a tumor in the ear, and we need to remove the tumor, and that destroys outer and middle ear, but has a efficient cochlea, and the nerve from there on is all right. In such a situation, we use what is called bone-anchored hearing implants. So God has given us a unique capacity to hear through the ear. That is what we call air conduction. It goes through the external ear canal, tympanic membrane, ossicles, blah, blah, blah. And then the other mechanism is when sound falls on the bone also transmits sound into the cochlea, into the inner ear directly. But since the air conduction mechanism, that is the pathway through which normally we hear, is a more efficient system, the sound reaches the cochlea earlier. Whoever is the winner wins, provides hearing. So the sound that comes through the bone reaches a little later, which is the reason why this mechanism is not evident, although it's happening as we speak. We all hear through the ear and through the bone as well, but the ear scores over the bone, because this makes the sound reach the cochlea faster than the bone. Now, in case there is no outer ear, middle ear, due to tumors, due to a lot of other diseases of the middle ear, inner ear, some of which can't be rectified surgically, then in that case, we need to use the bone conduction. So this is an implant that stimulates the bone in various frequencies, kind of does the work of the ear and feeds it to the cochlea, which is good. Whereas in the cochlear implant, the cochlea is not functional. Whereas in an osseous, this is used when the so these are two essentially different implants. But osseous is the newest implant in the market. Cannot be compared to a cochlear implant because the situation and the technology is different. This is for a different indication, and osseous is for a different indication. However, osseous is scores over and above the other previously the previous generation bone anchored hearing implant, because in the previous generation bone anchored hearing implants, the microphone processor and everything except the screw-like device, with what we call the implant, which is anchored to the bone, everything was outside. So now a lot of it has been pushed inside. So there is an internal component again, like the cochlear implant. There is a separate device which goes under the skin, and the outer component has become smaller, and that's where the breakthrough is when it comes to osseous technology. So it's a little complicated, technical, but yeah, I think when the word gets around, people understand what each technology is used for and what are the indications.
Okay. Could you briefly take us through the experience of having conducted Asia's first 2 consecutive osseous implantation surgeries?
So Asia Pacific, in fact, this implant was launched last year, and my center was one of the few centers to have received what is called a pre-launch session, where the company opened up about its new implant, and so we were trained to know about this implant and to surgically implant this. So we all got, a few of us across the country got our first experience with this new implant. Now, I did the first osseous in Asia Pacific alongside a skull-based surgery, and this was done for a patient from Iraq, for whom I did an osseous implant after removing a tumor in the skull base. So I do a lot of skull based surgeries. I'm a trained European board certified skull based surgeon. So this there was a tumor inside the base of the skull. The skull base is a bony foundation on which the brain sits. So we had to go and remove the tumor. So this patient was from Iraq, had facial paralysis and a few other complications. So we got down to operating the patient, removed the tumor, and we were the first to do the osseous alongside tumor removal in this case, and the patient is doing extremely well. So apart from surgical removal, we also restored hearing due to the destruction of hearing due to the tumor in the same sitting. So that is something that has happened for the first time, and ever since we have done close to 7 osseous, and I think the total number of osseas that have happened in India has been not more than 9 or 10 osseas. So we've got a considerable lead over other centers in the number of osseas we have done. And a lot of these osseas are being done simultaneously alongside skull-based surgeries, so that hearing restoration happens immediately. Otherwise, the old concept would be to remove the tumor, wait for some time, and then look at hearing rehabilitation as a second stage, only if and when necessary, kind of a situation. But we insist, and we persuaded our patients to consider hearing restoration immediately after surgery. So these patients benefit by not only by the fact that it's done immediately, but they also save another surgery which is necessary to put in the implant. There's a save on finances, the time and effort that is needed to do a second surgery. So all this is put into one surgery.
So what can we expect more when it comes to the future of hearing loss or future of hearing technology?
We can look into the past to see what's going to come into the future. So if you look at rehabilitation for hearing, let's say 20 or 30 years back, there was nothing that we had other than hearing aids, which, as I told you, are very miniature amplifiers, essentially technology-wise. So it was through the 80s and 90s that cochlear implant technologies picked up in the West, in the developed countries, and trickled down to India thereafter in the 90s. And so right now we see a lot of, first thing, we need to have more centers dealing with implants, whether it's cochlear implant, whether it's bone anchored hearing implants, whether it's auditory brainstem implants. This is the third category of implants where we put the implant directly into the brain. So there are different types, as I told you, different indications, different implants. So we need to have more trained surgeons, more centers, because we have 63 million people out there requiring rehabilitation. So even if we have 600 centers, that's not enough. And the number of centers we have in India where there are accomplished cochlear surgeons would be less than 100. And not even that, it could be anything between 50 and 75 centers. So where some real quality work is done, we're not talking about sporadic surgeons doing sporadic cases, but regular cochlear implant centers are very few. So when you're talking about what's in store in the future as far as India is concerned, I'm talking about more trained surgeons. And we, as at Bangalore Cochlear Implant Institute and at Manipal, we do implants. We not only do implants, we try to train younger consultants and the younger generation in cochlear implants in all the new technology that's coming in. By adopting ourselves to new technology, we are exposing this to the youngsters, and thereby they get to know what's the future. Second thing is technology. As far as implants are concerned, we are looking at reducing the size of the external component, so that makes it look sleeker, cooler. And we're looking at integrating the hearing, the implantable devices with a lot of electronical equipments. It's already been integrated into phones, and so we're using the Bluetooth technology. They can communicate with all the devices around. So that's going to be one of those things. And then more technically, if I were to get into more technical issues, we are talking about how the electrodes can stimulate the cochlea better. We are also researching into the orientation of the cochlea, the frequencies where the nerve endings are are situated, and the dynamics of the cochlea. And we are also looking at stem cell research, where we use stem cells to regenerate certain parts of the cochlea, the rest of which can be stimulated using the electrode. So amalgamation of stem cell technology with cochlear implant technology is something that is going to and then last but not the least, why not an implant that's developed and made in India? So most of the implants, all the implants that are available today are implants from outside India, and that makes it very expensive. So the cheapest implant we're looking at is about 6.5 lakhs. So that it goes up to 15 lakhs. So these are very expensive devices. And that's again one of the reasons why it's not penetrated into every household, that requires a cochlear implant. So the high cost forbids mass implantation. So it's high time that an Indian implant is developed, and we as an ENT community, and cochlear implant surgeons are working hard to enable the scientists in India, in the private sector, in the government sector, to come out with an Indian cochlear implant, which would obviously bring down the costs.
What's your message for this World Hearing Day, which we are seeing tomorrow?
So my first message is for the community out there to actually realize that deafness can be treated, deafness at various levels can be rehabilitated. There are implantable devices, there are hearing aids, and I would like everybody to shed the stigma of having a machine around your ears, having something around the ear, because these devices look very much like earphones, a Bluetooth devices that are worn in the ear. So I think it's very important for the community to destigmatize hearing loss, like how visual loss is destigmatized. So I don't think anybody looks at somebody who's wearing a spectacle, for instance, as somebody with a deficit or with a disability. Those days are gone. So similarly, one of the things that we need to do is to destigmatize hearing loss. The second thing is, a lot of people who are born deaf, unfortunately, a lot of people are born deaf have not received implants, and generally what happens is somebody who's deaf also ends up being mute, because deaf and mute is, unfortunately, they go hand in hand, because when a baby is born deaf, the baby obviously can't hear his or her own speech, voice, sounds. Even if the larynx is all right, the throat is good, if there is no problem in verbal communication, but since the sounds don't reach the ears, the baby doesn't realize the significance of what speech is, sound is, vocalization is. So they end up not using their, so that is why they are called deaf and mute. So a lot of children who have not been rehabilitated are deaf and mute, but they have excellent sensory perception when it comes to other senses. So a lot of such deaf and mute people today in the society are also stigmatized. In fact, we used to use the word deaf and dumb before. Now we have replaced, as a treating community, we have replaced the word dumb with mute. So deaf and mute, which also should bring down the stigma. So these people are not dumb people. They are extremely intelligent individuals. It's just that they can't hear, and due to which they can't speak, but their mental faculties are extremely sharp and agile. And it's very important that we recognize them as not to be mentally retarded or dumb. And the third thing is, if we all learn a lot of languages, we all learn, my daughter, for instance, is learning French, which is, so, but how about learning the sign language? If we learn the sign language today, if all of us are mandated, let's say, to learn the sign language, we bring in that 63 million people into the normal fold, isn't it? So that's where the barrier is. Communication is because we can't communicate. So instead of learning a lot of new languages, foreign languages, let's all take a pledge to learn the sign language. By learning the sign language, we then, because they know the sign language, the deaf and mute people know the sign language, they would want us to know it as well. So with a little bit of effort, we all can learn sign language, which would bring the whole 63 million people into the normal fold, with or without an implant. So communication is going to be possible. So this is my third message. Fourth one, obviously, is what we are all doing as surgeons. Increase the community of cochlear implant surgeons, audiologists, rehabilitation specialists, and the industry which manufactures all these devices. I would request them to somehow be able to, and also an appeal to the government of India, government of Karnataka, do something to bring down the cost of these implants, because that's what is prohibitive to a lot of people out there. So yeah, so happy World Hearing Day to everybody. Keep your hearing intact, preserve your hearing, and take care of your ears. Do not dismiss hearing loss, and do not take it lightly. Do not let it progress. And again, do not let people stigmatize anybody with a hearing loss. Come to an ENT surgeon, assess the hearing loss, immediately get yourself treated without neglecting it.
Thank you, Dr. Sampath. Thank you for your time and giving us insights into this very important topic.
Thank you, Madam Sujata, and thank you to all of you who have made it possible.